Hello, this is Dr. Danielle Barnes. I'm an associate veterinarian here at Jonesboro Family Pet Hospital. We are going to discuss one of my patients. Remmington is a 6.5-year-old German Shepherd who presented last November to our practice for what the owner was concerned with was some swellings underneath his neck. Upon physical examination, we did determine that they were enlarged lymph nodes. So to work up these lymph nodes that were swollen underneath the jaw, we went ahead and did a fine needle aspirate, which is where we take a needle and we put it into the lymph node and we aspirate back some of the cells. We make a slide of it and look under the microscope to look to see if we see any possible cancerous cells or inflammatory cells, just to kind of get a determination on if we think it is enlarged from cancer or whether it's enlarged from inflammation. We did determine that what we saw did look like cancerous type cells. We then proceeded to get a secondary opinion. So we went ahead and made some slides and sent them off to an outside laboratory, to a pathologist, and we did get a result back of it being confirming lymphoma in this patient. After further discussion with the owner about lymphoma itself and the risks and the problems that we can have with treatment, without treatment, we decided together to go ahead and go forth with treating this patient. We used a treatment that's pretty commonly used called the Modified Madison, Wisconsin therapy. It is a 25-week treatment. We did wear all of the chemo-approved gowns, gloves, eyewear, masks, anything that we needed to protect us. The doxorubicin, which is a very scary drug to administer, you want to make sure that you don't get even one drop out of the IV. So when we set our IV, we go ahead and give a mild sedation just to keep the patient very calm and still so that we don't jerk and move that IV catheter out while the medication is being administered. So we have somebody monitoring the flow of the drug so that we can increase and decrease the drip as we go along. Throughout the 25-week period, there were some weeks of rest. So after we did certain chemotherapeutics, we would have either a 2-week rest period, 1-week rest period, just depending. Remmington finished his last chemo treatment May 31st of 2019. He did fairly well. We did have some weeks where, the vomiting, nausea, not wanting to eat. Usually with our vincristine injection, we kind of figured out that one was kind of, it took him about 5 to 6 days after that to kind of get back to his normal eating habits and activity level. And as of right now, he is doing well. We will continue to monitor all of our lymph nodes and blood work just to make sure that we can continue to stay in remission. Now that I have done this complete treatment and I have had all the support from the wonderful staff here at Jonesboro Family Pet, they have helped me, they supported Remmington, they supported me, and I think as long as I can have them to have my back too, then I think we can do further treatments.